This clinic had been closed for a long time, about 5 years. And they literally, it appeared that they had gotten word they had to close, and they locked the door and walked away. I mean, it was just as, it was eerie. It was like there were still open charts on the desk. There were dirty speculums in the sink. It was just like someone walked away. There was garbage in the garbage can. Someone just locked the door and walked away. We opened the doors and saw what we had to do, and we worked for 2 weeks just cleaning from daylight till dark, my husband and I. Cleaning, scrubbing, painting, just getting it ready to be a clinic again, including taking out a termite nest that was as large as a turkey. I mean, it was huge. The trails went over the exam table, and I remember chipping those off and scrubbing the ceiling and scrubbing the walls. And then the very next morning when we showed up again at 7 o'clock in the morning, they were halfway across the ceiling already. So there were a lot of kind of discouraging things. We battled insects, mosquitoes, and every other kind of flying, biting thing, and geckos climbed the walls in the clinic. But we learned to accept those things. The people of the area were used to it. It didn't bother them. So, I had to kind of reevaluate my idea of cleanliness and what was and wasn't really important for providing care. And the fact that the termite trail was across the ceiling and the geckos were on the wall wasn't nearly as important that I had soap and water there to wash with and a way to sterilize the equipment and that sort of thing.